Hi guys, welcome back to my YouTube channel. I hope you all are fine and liking the video. Guys, in this video we will discuss about health insurance in United States such as USA. So let's start the video by discussing the topic health system work. How does the US health system work? Healthcare is the United States is organized in a complex bureaucracy, while in the rest of the world, healthcare facilities are owned mostly by the government or by private sector business. In the US, a large share of the hospitals and clinics are owned by private and non-profit organizations. Yes, the United States is the country that has the highest healthcare expenditures in the world. While these expenditures are covered in a large share by public payers, as by federal institutions or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed nations, the US health system doesn't provide health care to its entire population. Let's go toward the insurance. Health insurance in the United States for non-citizens. The United States government doesn't provide health insurance for all its people, and health insurance is not obligatory for those living in the US. It is optional but highly recommended and necessary since health services are very costly, more than in any other country anywhere across the globe. There are two types of the health insurance in the US: private and public. Most people use a combination of the both. US public health insurance are Medicare, Medicaid, Children Health Insurance Program, travel insurance for the visitors in the USA, health insurance for the international students in the USA, health insurance for the dependents of the international students, health insurance for J1 visa holders, health insurance for the foreign worker on the H1B visa, health insurance for the dependents on an H4 visa holder, health insurance for the green card holders, health insurance for K1 visa holders, health insurance in the USA for the Canadian experts. The USA has the most expensive health care in the world. That's why getting adequate health insurance coverage come highly recommended. Now we will talk about Medicare. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for the USA nationals older than 65 years old, but also for the younger people with end-stage renal disease, ALS, and some other disabilities. Data show that in the 2018, Medicare provided almost 60 million individuals with the health care in the US, over 51 million of which were other than 65. The Medicare program is divided into four parts. Part 1, which covers the hospital, skilled nursing and hospice services. Part 2 covers the outpatient service including some provider service, while inpatient at a hospital, outpatient hospital charges. Part C is an alternative called Managed Medicare, which permits patients to select health plan with at least the same service coverage as a Part A and B. Often the benefits of Part D and an annual out-of-the-pocket spend limit which A and B lack. To sign in this part, one must sign in Part 1 and B first. Part D cover most self-administered prescription drugs. Then we will talk about Medicaid. Medicaid is a federal and state program that help people with the limited income and resources to cover the medical cost, while covering benefits normally not covered by Medicare as nursing, home care, and personal care services. It is the largest source of funding for the medical and health related services for the people with the low income in the United States. Data shows that the US provided health insurance to 71 million people with low income or disabilities, which is 23% of the total of the US population. Now we will talk about Children Health Insurance Program, formerly known as the State Children Health Insurance Program. This is a program that covers with the health insurance children of the family with the modest income that are not low enough to qualify or Medicaid. Now we will talk about text, which is Get a Healthcare Insurance Program. Get ASAP, enter your zip code to get your free health insurance program. Now we will talk about Affordable Care Act, Abandonment Care. The Patient Protection and Affordable Care Act is a federal statute signed into law by President Obama, which made it mandatory for every citizen to have the health insurance for be penalized. The act subsides for a low-income family by taxing healthcare providers or high-income families, as it was designed to the lower healthcare cost by providing the better healthcare for the Americans. The Affordable Care Act followed parents to add their children up to the age of the 26 to their policies in a bid to have younger healthy people paying premiums. It also allowed poor people to get treated for the chronic illness instead of using the emergency room. US private health insurance. There are about 1,000 private health insurance providers in the US, with each of them offering different plans with the different prices, which are largely depend on a person's medical history. However, while there are individual plans covering only one person, there are also group plans targeting families in the particular. Usually there are three types of the health insurance in the United States: traditional fee for service health insurance plan, health maintenance organization, preferred provider organization. Now we will talk about the traditional fee for service health insurance program, which plan are usually the most expensive and which is health maintenance of organization offer a limited choice of the healthcare providers, and preferred provider organization which just look at HMOs after lower co-payments, but they give you more flexibility when selecting a provider, as they give you a list of the provider among which you can choose. So guys, if you like our video, please tell us in the comment section. Thank you so much for liking and supporting.